The hidden dangers of diphenhydramine. Why you should avoid Benadryl. Imagine grabbing what seems like a simple allergy pill, only to discover you've unknowingly put yourself at risk. That's exactly the scenario Dr. Anna Wolfson encounters daily in her Massachusetts General Hospital clinic. Patients confuse diphenhydramine, the active ingredient in many over-the-counter sleep and allergy remedies, with a cure-all for allergic reactions. If someone has a food allergy incident, they'll say, "I've got diphenhydramine on hand," and I have to remind them that epinephrine is the only first-line defense, Wolfson explains. Relying on diphenhydramine can be dangerous because its drowsy effects might mask warning signs of a worsening allergic response. But here's where it gets controversial. A growing number of allergy experts argue that diphenhydramine has outlived its usefulness. In a recent review by specialists from Johns Hopkins and UC San Diego, published in the World Allergy Organization Journal, researchers petitioned to remove diphenhydramine from both prescription and over-the-counter markets in the U.S., branding it outdated and unsafe compared to newer antihistamines. Diphenhydramine first hit the market in 1946 as a first-generation antihistamine. It's been the go-to remedy for everything from hay fever and insect bites to sleeplessness, which explains why retail sales skyrocket every summer. But unlike modern cousins such as Loratadine, Claritin, Cetirizine, Zyrtec, or fexofenadine, Allegra, diphenhydramine crosses the blood-brain barrier, often causing sedation, slowed thinking, and even dangerous heart rhythm changes. And this is the part most people miss. In older adults, diphenhydramine can linger for up to 18 hours, leading to persistent grogginess, memory issues, and an increased fall risk. Some studies even hint at a link between chronic use and dementia. Children aren't off the hook either. Reports include accidental overdoses, paradoxical reactions like extreme agitation or coma, and tragic fatalities linked to viral Benadryl challenge stunts on social media. I worry when families use it as a generic sleep aid or cold treatment, says Dr. Manuela Murray, Director of Pediatrics at UTMB. It's only approved for allergic reactions and motion sickness. And in kids, it often backfires, sometimes making them hyperactive. Pediatrician Alyssa Kuban concurs and recommends Cetirizine instead for itchy rashes and hives. It works longer, keeps little ones alert, and has a far safer profile. Despite these concerns, diphenhydramine shows up in over 300 cough, cold, and allergy formulas, often mixed with pseudoephedrine and other ingredients. The World Allergy Organization review suggests moving all diphenhydramine products behind the pharmacy counter, at the very least to prompt pharmacist guidance, or banning them altogether. After all, second-generation antihistamines have proven equally or more effective for sneezing and itching, with minimal impact on nasal congestion and far fewer side effects. It's a startling fact that more than 1.5 million diphenhydramine prescriptions are still written each year in the U.S., not including countless over-the-counter purchases. In the eyes of many experts, its era has passed. Is it time to bid Benadryl farewell? Or do you believe there's still a place for diphenhydramine in medicine cabinets? Share your experiences or disagreements below, and let's spark a conversation about what safety really means when it comes to allergy relief. Is Benadryl dangerous? Risks you should know about this common allergy medication. Old claim alert. Health experts are sounding the alarm about Benadryl, a common allergy medication that might not be as beneficial as we once believed. In fact, it could be causing more harm than good in the long run. Benadryl, known by its generic name, diphenhydramine, was the first antihistamine approved by the FDA way back in 1946. At the time, it was a groundbreaking solution for allergy sufferers. However, recent research is casting a shadow over its widespread use. In a recent review by the World Allergy Organization Journal, researchers are urging us to reconsider our reliance on Benadryl. The drug works by crossing the blood-brain barrier, which blocks the signal in the brain that triggers an immune reaction to allergens like pollen or nuts. But here's where it gets controversial. This mechanism can also lead to grogginess, increased risk of falls, car crashes, and even potentially dementia. Benadryl mimics the neurotransmitter acetylcholine, which plays a crucial role in functions like memory. A 2015 study from JAMA Internal Medicine found that people who took acetylcholine-blocking drugs had a staggering 54% higher risk of developing dementia and a 63% higher risk of developing Alzheimer's disease. This is the part most people miss. The long-term effects of Benadryl could be more serious than we initially thought. The World Allergy Organization journal also linked Benadryl to poor school performance. The drug was associated with significant deficits in tests of divided attention, working memory, vigilance, and speed. This raises important questions about the impact of Benadryl on cognitive function, especially in younger individuals. Doctors agree that occasional use of Benadryl is acceptable if no other alternatives are available. However, they recommend opting for other allergy medications like Zyrtec or Allegra whenever possible. But here's a thought-provoking question. Should we be more cautious about the long-term use of Benadryl, given these potential risks? Share your thoughts in the comments below. Is it time to rethink our reliance on this old standby, or are the risks being overblown? Is Benadryl outdated? What allergy experts want you to know? The shocking truth about Benadryl. Why experts are raising red flags. A startling health revelation has emerged about a medication that's been a staple in American medicine cabinets for generations. Medical specialists are now labeling a widely used over-the-counter remedy as obsolete and potentially hazardous. Allergy experts have recently issued warnings about Diphenhydramine, commonly recognized by its brand name Benadryl, describing it as outdated and possibly dangerous despite its widespread use for decades. Diphenhydramine belongs to the category of first-generation antihistamines and has been available since the 1940s. Consumers typically reach for it to address allergic reactions, symptoms of the common cold, skin irritation from insect bites or poison ivy exposure, and occasionally as a sleep aid. To understand the concerns, it's helpful to know how antihistamines function in your body. These medications work by blocking H1 receptors, which play a crucial role in your body's response to allergens, substances that trigger allergic reactions in susceptible individuals. When these receptors are activated, they can produce uncomfortable symptoms including sneezing, itching, and nasal discharge. But here's where it gets concerning. While diphenhydramine effectively reduces sneezing and itching, these older antihistamines don't just target allergy symptoms. They impact other brain functions as well. This broader effect can result in significant drowsiness, cognitive impairment, and in certain situations, dangerous cardiac complications. Particularly alarming is how diphenhydramine affects vulnerable populations. In elderly individuals, the drug can remain active in the system for up to 18 hours, substantially increasing the likelihood of falls and confusion. For children, the risks are even more severe, including excessive sleepiness, irritability, unusual hyperactivity, potential overdose, and in extreme but documented cases, coma or fatality. These serious concerns have led specialists to advocate for safer alternatives. A comprehensive analysis conducted by allergy specialists from prestigious institutions, including Johns Hopkins University and the University of California, San Diego, has gone so far as to recommend removing diphenhydramine from direct consumer access or, at minimum, placing it behind pharmacy counters. This would allow pharmacists to guide consumers towards safer options. Many people are unaware that diphenhydramine is an ingredient in more than 300 over-the-counter products, frequently combined with other medications targeting coughs, colds, and influenza symptoms, meaning consumers might be taking it unknowingly. Fortunately, better options exist. For treating most seasonal allergies, hives, or mild allergic reactions, second-generation antihistamines offer superior safety profiles. These include medications like Loratadine, marketed as Claritin, Cetirizine, Zyrtec, or fexofenadine, Allegra. These newer alternatives provide longer-lasting relief, cause less drowsiness, and generally pose fewer risks for both pediatric and geriatric populations. For infants and young children experiencing nasal congestion, simple solutions like saline drops followed by gentle suctioning can provide effective relief without medication. And this is the part most people miss. In cases of serious food allergy reactions, epinephrine, not Benadryl, should always be administered as the first-line treatment. The most crucial takeaway is to consult with healthcare professionals, either your pharmacist or physician, before using diphenhydramine. These experts can help identify the safest and most effective treatment options for your specific symptoms, while minimizing potential side effects. What's your experience with Benadryl or other antihistamines? Do you think these older medications should be removed from store shelves, or should consumers maintain the freedom to choose? Share your thoughts in the comments. Has this information changed how you'll approach allergy treatments in the future?